I'm Patrick Hwu, CEO of Moffitt Cancer Center, and we're here with Dena Ramirez, manager of the Sterile Processing Unit at Moffitt Cancer Center. Tell us about sterile processing. You guys are really heroes behind the scenes. A lot of people don't know this department exists.
That is very true.
What do you do?
So we basically handle all of the surgical instrumentation for all of the surgeries happening throughout all of Moffitt campuses, including the clinics. We basically clean them, disinfect them, sterilize them, and get them ready for surgeries.
What is the process when you get you're using an instrument in the operating room, and then where does it go?
Straight from the operating room, it comes downstairs to here, sterile processing, where we then in turn clean it, we disinfect it, and then we either high-level disinfect it or sterilize it with one of our machines here.
And what were you looking at here?
We are looking here at the washers that actually wash the instrumentation. This is where after we manually wash the instruments, we put them through these machines to kind of get a thermal disinfection before we can inspect it and package it for sterilization. Yes.
So they get manually washed, and then they get washed in the washer.
That is correct.
And then they get sterilized in the autoclaves.
Well, after the washers, they kind of come over here. We have to inspect them for cleanliness, make sure that they are complete and ready to get packaged. From there, we then sterilize them.
I see. Show us where the sterilizers are.
Absolutely. So here we have two types of sterilizers. We have our autoclaves, which is steam sterilizers, and then we have our low temperature V-Pro sterilizers on this side. So depending on what the IFU says, this will determine which process we use.
I see. How many items a day do you guys sterilize?
Oh, we probably sterilize over 150 trays a day. If I had to go by the instruments, I'd say probably about 15 to 20,000.
Wow, that's a lot. Yeah.
It is.
Wonderful. You guys have a real dedicated crew and a really important work behind the scenes to make sure that patients who come for procedures at Moffitt Cancer Center have pristine instruments that are going to always be sterile.
Absolutely. That is our #1 goal, is to make sure that our patients have clean and sterile instruments for every procedure.